Hey, Latrice, you and your family have a terrific holiday. Leg pain can range from a mild nuisance that comes and goes to debilitating pain that makes it really tough to sleep, to walk, even engage in simple everyday activities. The pain can take many different forms. Some patients describe the pain as aching, searing, throbbing, or burning. Come on, we need some help. Here's our terrific friend and chiropractor, Nick Circolone from Apple Physical Medicine Center. Great to have you here.
It's always good to be here,
Hey,
Jay.
listen, you got that twitching leg syndrome, restless leg syndrome that people complain about at night. This could be really debilitating.
Well, you know, sometimes we have neurological problems that chiropractic doesn't deal with well. But if you have problems where there's compression of nerves, like in the foot, you know, I brought a little leg with me. You know, it's funny. In the lower extremities alone, on each lower extremity, there's 30 bones. There's 26 in a foot alone. So if the foundation of that leg is not working properly, all of that energy gets translated somewhere else, into the ankle, into the knee, into the hip, and into the low back. Sometimes we have problems where the low back causes foot pain. But a lot of times, if we can get the foundation corrected, we're able to decrease some of the pain that you have along that
This
area.
has got to be painful for people with diabetes, arthritis. So what do? What's your recommendation?
You know, one of the things when we're dealing with arthritis, that's easy that we can just give them some exercising. We'll put them in orthotics. We'll giving them some massage kind of techniques to do. We'll use different techniques where they can get the fascia to loosen up. You've heard of plantar fasciitis.
Sure, we talked about that yesterday.
Right. So plantar fasciitis, if we can release some of that, that foot will feel better. But with a diabetic, we're dealing with a totally different issue. The nerves themselves start to die off because of the diabetes, and that's really hard to really control, number one, and number two, to repair. So what we want to do is we want to make them comfortable with shoes and orthotics.
And you've talked about this, orthotics. You actually make them at your facility there. You're going to get ripped off if you go to these stores and buy them because it's not really doing you any good.
We don't actually make the orthotic. What we do is we cast you for the orthotic,
okay.
and then we send them out, and then
Which
you know,
is a lot different than what you do when you go to a store
right.
and buy it.
And these are specifically designed for the patient. Now, the orthotics that we do are called softotics. A softotic is used basically to help mold the foot, whereas a hard orthotic is a supportive orthotic. But we do a soft orthotic for everyday activities.
So what can a chiropractor do? What can you do to help leg pain?
Well, what's really interesting is if there's a problem with joint misalignment, we can work on the joints. You know, it's funny. Most people think that chiropractor just deals with the spine. Well, there's other joints in the body. If there's a joint in the body, if it's neuromusculoskeletal, we'll deal with it. We can adjust the foot, we adjust the ankle, we adjust the knee, we adjust the hip to help stabilize that foundation so patients feel better.
Sciatica, the pain that's coming down these legs, where is it starting from?
You know, sometimes the pain can be related to a poor foundation of the foot. But sometimes there's degenerative changes in the lumbar spine which will cause that sciatica.
Listen, let me tell you, if I've got a hamstring muscle that's really tight, I'm going to feel it in my back. It hurts when I walk.
Oh, absolutely.
I mean, you got to think about these things. It is truly all connected here.
And what we talked about before, I say this all the time, we need to do some stretching. You know, constant stretching, constant movement. Movement is the key. Once we can get things moving, the better we're going to be.
Nick, you've also talked about core strength, and if you build that core strength, you are going to have less problems in the lower extremity.
Absolutely. But here's another point about the core. If your foundation is not working properly, you'll never get the core to work properly because you won't want to. You'll be off balance and off kilter. So we have to work on those joints to actually help you to strengthen that core.
All right, today we're talking medicine. The last time you were here, we made the most incredible meatballs with you. I'm still talking about
Well,
that.
you know, I brought you some stuff that we made. My wife and daughter helped me make we made regatta cookies and we made mandel bread for
Nick, you are terrific, buddy. You can do it all. And listen, congratulations. You just got a special certification. Would you explain that while we put your information up on the screen?
Actually, I just became a chiropractic orthopedist. Basically, I'm a non-surgical orthopedist. I'm more of a liaison between chiropractic and medicine.
And you also are getting a nurse practitioner beginning in February.
Yes.
You've also got a physical therapist. It is Apple Physical Medicine Center. It is right next door to the Hamilton YMCA on Shallowford Road, 855-7376. And what I love about Nick, is open in the morning at 6:30. It's great for those folks who are hitting that first shift. Nick, happy holiday, buddy.
Happy holidays.
You give
Thank you so
back
much.
to the community. It's great to have your wife and daughter here as well. Hey, beautiful ideas for your kitchen. Straight ahead.